Welcome to my channel. In this video, we will be discussing the kidney diet, the right diet that will help you to slow the progression of your kidney disease, or CKD, and improve the overall quality of life. But before we begin, don't forget to hit that subscribe button and the notification bell so you don't miss any of our informative videos. CKD is a global health concern, affecting millions of people worldwide. Chronic kidney disease is a medical condition where the kidneys gradually lose their function over time. It is associated with various risk factors, such as high blood pressure, diabetes, smoking, obesity, and a family history of kidney disease. Kidneys are vital organs responsible for filtering waste products and excess fluids from the blood, which are then excreted as urine. They also help regulate blood pressure, maintain electrolyte balance, and produce hormones that control various bodily functions. CKD is typically categorized into 5 stages, ranging from mild, stage 1, to severe, stage 5, or end-stage renal disease. As CKD progresses, the kidneys become less efficient at their functions, which can lead to complications. Managing your diet plays a crucial role in slowing down the progression of this condition and improving your overall quality of life. Now, the first dietary tip is to limit your sodium intake. Sodium is an essential mineral found in many foods and is a component of table salt. While sodium is necessary for various bodily functions, excessive intake can lead to health issues, especially for those with CKD. High sodium intake can increase blood pressure, putting extra strain on the kidneys. It can lead to fluid retention, causing swelling and discomfort. The recommended daily sodium intake varies depending on CKD stage. For individuals with early stage CKD, stage 1 and 2, it's typically advised to limit sodium to around 2,300 milligrams per day, which is roughly equivalent to 1 teaspoon of salt. For those with advanced CKD, stages 3 to 5, especially if they have high blood pressure, fluid retention, or other sodium-sensitive conditions, a stricter limit of around 1,500 milligrams per day is often recommended. To reduce sodium intake, it's essential to identify and avoid high-sodium foods, such as processed foods, for example, canned soups, frozen meals, and snack foods. Fast food and restaurant dishes, which often contain hidden sources of sodium. Certain condiments, sauces, and seasonings, for example, soy sauce. Pickled and cured foods. Use spices, herbs, or alternative seasonings, such as lemon juice and hot pepper instead of salt. Reading nutrition facts labels can help you make informed choices by checking the sodium content. Consult with a healthcare provider or registered dietitian to create a personalized dietary plan. Second tip is to limit your phosphorus intake. Phosphorus is a mineral that plays a critical role in various bodily functions, including bone health and cell function. In individuals with healthy kidneys, excess phosphorus is efficiently removed from the body. However, in CKD, kidneys may struggle to regulate phosphorus levels, leading to imbalances. High phosphorus levels in CKD can be problematic for several reasons. High phosphorus can cause secondary hyperparathyroidism, where the parathyroid glands overproduce hormones, which leads to excess removal of calcium from the bones, resulting in weakened bones and increased risk of bone fractures. High phosphorus can also contribute to the calcification of blood vessels and soft tissues, which increases the risk of cardiovascular complications. The recommended daily phosphorus intake again varies depending on the severity of CKD. For individuals with early stage CKD, stages 1 and 2, the recommended daily phosphorus intake is typically around 800 to 1,000 milligrams. For those with advanced CKD, stages 3 to 5, especially when blood phosphorus levels are high, a stricter limit of approximately 800 milligrams per day, or even lower, may be advised. These patients may also be advised phosphate-binding drugs, which limit the absorption of phosphorus in blood. To limit phosphorus intake, it's crucial to identify and avoid high phosphorus foods, which often include dairy products, for example, milk, cheese, yogurt, processed and fast foods, for example, cola drinks, processed meats, canned foods, nuts and seeds, certain whole grains, and bran cereals. Reading food labels to check for phosphorus content is important. Consult with a healthcare provider or dietitian for personalized dietary recommendations. Tip number 3 is to monitor your potassium intake. Potassium is an essential mineral that plays a vital role in various bodily functions, such as muscle contractions, nerve function, and heart rhythm. However, in CKD, the kidneys may struggle to regulate potassium levels, potentially leading to hyperkalemia, a condition characterized by high blood potassium levels. High potassium levels can disrupt normal heart rhythm, leading to dangerous arrhythmias, or it can even result in cardiac arrest. It can also cause muscle weakness, numbness, and tingling. The recommended daily potassium intake varies, depending on individual health status and CKD stage. However, in general, for individuals with early-stage CKD, stages 1 and 2, potassium intake may not need to be restricted as severely, and they can typically aim for around 2,000 to 3,000 milligrams of potassium per day. For those with advanced CKD, stages 3 to 5, especially if they are prone to high potassium levels, a stricter limit of approximately 1,500 to 2,000 milligrams per day may be recommended. Certain medications like angiotensin converting enzyme inhibitors, angiotensin receptor blockers, and spironolactone should also be avoided. To limit potassium intake, it's crucial to identify and avoid high potassium foods, which often include bananas, oranges, and other citrus fruits, potatoes, sweet potatoes, and tomatoes, beans and lentils, dairy products. Tip number 4 is to monitor your protein intake. Protein is a crucial macronutrient that is important for muscle maintenance, tissue repair, and immune function. However, when you have CKD, managing protein intake becomes critical as the breakdown of protein in the body produces waste products, including urea and creatinine, which the kidneys must filter out of the bloodstream. This increases the workload on already compromised kidneys. High urea levels can affect cardiac and neural functioning. By limiting protein in diet, we can delay the decline in kidney functions and slow the progression of CKD. The recommended daily protein intake for CKD patients varies depending on the stage of the disease, nutritional status, and individual health needs. In general, for CKD stages 1 and 2, protein intake is often similar to that of the general population, which is around 0.8 grams of protein per kilogram of body weight per day. Once your glomerular filtration rate starts to decline, it is better to get more plant-based proteins, as they break down to less urea than animal proteins. If you have CKD stages 3 to 5 with GFR 59 or lower, unfortunately, you will need to restrict your protein even more. Studies now show that limiting protein to 0.55 to 0.60 grams per kilogram of your body weight can delay decline in kidney function. For example, if your weight is 68 kilograms, your protein needs are 40 to 54 grams per day. This equals about 4 to 6 ounces of protein. For individuals undergoing dialysis, which is a form of kidney replacement therapy, protein requirements are typically higher than for CKD patients not on dialysis, as it removes waste products, including excess urea and creatinine, from the bloodstream during treatment, and allows patients to tolerate a higher protein intake. It is very important to consult with a healthcare provider or dietitian to determine you the right amount and type of protein. High-quality plant-based protein sources like beans, lentils, and tofu can be better options than excessive animal proteins. Tip number 5 is to monitor your water intake. Water intake is an essential aspect of managing chronic kidney disease. Proper hydration helps maintain overall health and supports kidney function. In the early stages of CKD, when kidney function is only mildly impaired, there are generally no strict restrictions on fluid intake. Most patients can follow the standard recommendation of drinking around 8 cups or approximately 2 liters of water per day. However, it's important to monitor fluid balance and adapt based on individual needs. Some patients may need more or less depending on factors like climate, activity level, and urine output. As CKD progresses, especially in the later stages and when patients are no longer producing urine, some patients may experience fluid retention, swelling, and high blood pressure. In such cases, healthcare providers may recommend fluid restriction. The specific fluid restriction varies, but is typically around 1,000 to 2,000 ml per day, or as advised by a healthcare provider. To stay within these limits, patients should be mindful of not only water intake, but also the fluids present in other beverages and foods. Pay attention to your urine output and any signs of fluid retention, such as swelling. This can help you and your healthcare team assess your fluid balance. It's often recommended to spread fluid intake throughout the day, rather than consuming large amounts at once. This can help manage fluid balance more effectively. Be mindful of fluids in foods, such as soups, fruits, and vegetables. These contribute to overall fluid intake. Before making any significant dietary changes, it's essential to consult with a healthcare professional or a registered dietitian who can provide personalized guidance based on your specific condition and needs. If you found this video helpful, please give it a thumbs up, share it with others who might benefit, and don't forget to subscribe for more informative content on health and well-being.